Welcome to Good News BNSSG. My name is Mary Carter and I'm a pharmacy technician and the Pharmacy Education Project Lead at the BNSSG Training Hub. We aim to showcase some of the great initiatives and projects going on in primary care within our area. In this episode, we are spotlighting two key professions within primary care. Firstly, let's hear from Ade Williams on his career as a community pharmacist and how his team are delivering health and wellbeing initiatives to people in local communities.
My name is Ade Williams. I'm the lead pharmacist at Bedminster Pharmacy in Bristol. While I was doing my A-levels, I used to go past the pharmacy every day. And I was really drawn to the fact that everybody seemed to be going in there and the pharmacy seemed to have a real health hub sort of role in the community, and not just delivering care, but also guiding and supporting people. One of the things that I really enjoyed during my training years was that I had the opportunity during that summers of the training to travel a bit and see how care is delivered and seeing the difference, actually appreciating fully how the NHS is unique in its offer, that you are able to have this universal access to care and how patients don't have to pay for their care there. And I think that is something that has always stayed with me. I love the fact that community pharmacy is the most accessible part of the NHS footprint, and how being able to maintain long relationships builds trust, which then means that you become a valued and appreciated part of how the NHS functions. One of my favorite ones is always to remind people that when the NHS was formed, pharmacy joined the NHS before general practice did. So we've been part of the NHS right from the beginning. But also is that the practice of pharmacy for a long time simply seemed to have been the delegation of the role to dispense and create this legal safety check and quality framework around medicines. And in truth, as the profession is broadened out, rightly so, it's become much more our role as well to help to manage, to make decisions about how to improve patient care. So one of the ones that I really liked was about us starting to do blood pressure checks in the pub beside us. And it really came from the fact that we were faced with doing the blood pressure awareness week. And I said, well, the patients that we need to get to, they're not the ones coming in here, they're next door. So up we go to the bar in the pub and just say, well, this is what we're doing. They're completely bemused at us. And we say, well, this is not really about the results. What we're trying to do is we want the population to see us here, to talk to us, to engage with this, because next time they're going past, it will be okay to just step in. There has been recognition for that, in different ways, and that's a credit to a whole team effort and a community that's willing to allow what was a quirky pharmacy way of delivering care, because it's actually about how do we make sure that the care that we provide is relatable to you. Unfortunately for me, that is sometimes made that I wear a purple wig on a day to highlight pancreatic cancer awareness, but it's a privilege to do what we're able to do, and doing it well. That is the value that we have, is that people don't need us when their health is at its worst state, but actually we're supporting them to stay healthier. So that's my journey.
Huge congratulations to all the team at Bedminster Pharmacy for their awards, accolades and innovative strategies to engage and improve the health of the local population in Bristol. For our next clip, we hear from Ghislaine Swinburn, a local dietitian. Ghislaine tells us about her role and career.
My name is Ghislaine Swinburn. I'm a PCN dietitian, that's a primary care dietitian, and I work in Bristol Inner City Primary Care Network. The dietitian takes nutrition and applies it to medical conditions. So for instance, I might be working with someone with diabetes and their diet's really important in managing their condition. So I'll be educating them on diet and how that applies to their diabetes management. I've been working for 30 years, so I've done a lot over those years. I started in secondary care, which is what dietitians do, because it gives you a good grounding, and we pick up different specialties along the way. I worked as a volunteer dietitian. I took a round the world trip. I find myself in Ecuador at a nutrition feeding program, and I spent a year running that and teaching the indigenous tribes in the Amazon jungle about nutrition. Because of deforestation, they've lost their protein source, which is monkeys, and they were surviving on yucca, which is a root, so they were completely missing protein. And that was a fantastic experience. I travelled by dugout canoe and was paid in bananas. When I came to primary care dietetics, I was actually the first FCP primary care dietitian in the UK. So I was right at the very beginning. So it was really educating people and beginning to set up a service and finding out what was needed. And that's one of the things about dietetics, is you can be very creative and you can drive forward a new service. So it was difficult, but it was also very inspirational for me because I had the opportunity to set up a service. People know about dietetics, but when you think about dietetics, most people will think about obesity management or diabetes. And in primary care, we actually have community services to manage them. So part of what I did in the beginning was look at the gaps in the service, look at my skills and experience and see how they could be fit together. One of my loves is gastroenterology. So I work with people with pancreatic disease, celiac disease, irritable bowel syndrome, inflammatory bowel disease. So it's much more clinical. My interest in dietetics is different from someone who might be working in public health and is looking at nutrition and healthy eating. Mine is really about the application of diet to disease conditions. My job is really varied. Bristol Inner City is an area of high deprivation and it's very multicultural. So as a dietitian, for every patient I see, I have to provide individual advice. And I listen to people's story and really delve into what their issues are. I mean, it might be their environment, stress that's affecting why people eat, because there's lots of reasons why people eat. So it's a holistic management of issues that a patient might bring to their GP. I think that the success for me is in patient feedback. One of the things I hear most frequently from patients is firstly the gratitude that someone's listened to them and actually given them a plan, because dietetics has just been missing from general practice. But the thing I hear most often from patients is, why didn't I see you before?
What an interesting career, and really inspiring to hear from the very first dietitian to become a first contact practitioner in the UK. It's clear that dietitians are helping to transform population health in BNSSG. If you would like to know more about careers in primary and community healthcare, please do check out the link in the description box. If you have some good news that you'd like to share with us, again, check out the description box for our details and get in touch, or scan the QR code here. That's all for today. I hope these clips have given you some inspiration or just provided some insight into some of the great things that are happening across BNSSG.